Hello,
Hey,
my name's Paige. I'm a Harper College nursing student. Is it okay if I do a head-to-toe assessment on you today?
go for it.
All right, so just looking at you, I can note that your skin color is appropriate. Can you tell me where you are right now?
Harper Hospital,
Perfect. Can you tell me your full name and date of birth?
April Leggett, July 5th, 1989.
Can you tell me what year it is?
2019.
And can you tell me why you're here today?
I had some shoulder pain.
All right. And about how tall are you?
5'3",
Perfect. And how much do you weigh?
135.
Okay, so we calculated your BMI and it was 21.9. So just looking at you, I can see that your skin color is appropriate. You're alert and oriented times 3. You're conscious, you're alert, you're talking to me, and your speech is appropriate and clear. The next thing I'm going to do, and we did your Snellen chart earlier and your vision was 20/20, which is good, and that was testing your cranial nerve number 2. Next thing we're going to do is we're going to move on to your head, and I'm just going to inspect first, but then I'm going to palpate, okay? So I can just look, and I don't know any lesions or bruising or abnormalities. If I palpate, do you feel any tenderness?
No tenderness.
Good. And I'm going to push on your sinuses. Your frontal first, do you feel any tenderness?
No tenderness.
And then your maxillary sinuses, do you feel any tenderness?
No tenderness.
Okay, and then your temporal mandibular joint, open? Good, close? Perfect. And then I'm going to look at the symmetry of your face by looking at your eyebrows, your eyes, your nasolabial folds, and the corners of your mouth. Good. Everything looks symmetrical and normal, so that's good. And your head is normal shape and size, normal cephalic for your body type, so that's great. I am going to then examine your eyes, and we're going to do the 6 cardinal gazes, and that's going to test cranial nerves 3, 4, and 6. So I'm going to have you just follow this pen with your eyes and not your head, okay? So we're going to go up, good, down, good, good. And then towards the middle, good. And then that's just testing for accommodation. So your pupils are equal, round, reactive, and accommodating to light. So that's PERLA. So pupils are equal, round, reactive to light, and accommodation. So the next thing we're going to do is we're also going to do the pupillary light reflex, okay? So your pupil should contract down 2 sizes given the stimulus here, okay? Good. On this side. Good. So your pupils contract from about a 5 to a 3. So the next thing I'm going to do is I'm just going to look at your nose, the symmetry of your nose, and I'm going to palpate. Do you feel any tenderness?
No tenderness.
Good. And then can you clog one side of your nose and take a deep breath in? Good. And then the same on the other side? And is one side easier to breathe than the other?
My left side's easier than my right.
Your left side is easier than your right. Okay, good. Next thing I'm going to do is I'm going to inspect your ears. So I don't know any abnormalities, no lesions, no bleeding. And then I'm just going to palpate your pinna. Good. And your tragus. And there was no tenderness with that, correct?
No tenderness.
Okay. So we're going to test cranial nerve number 8. And what I'm going to do is I'm going to whisper something and I want you to repeat it back to me, okay?
Okay. Wheelchair. Mannequin.
Good. So the next thing we're going to do is I'm going to look in your mouth, okay? So I'm just going to look. Can you open for me? I'm going to look at the mucosa, make sure it's pink and shiny. I'm going to look at the top of your mouth, and then underneath your tongue, the floor of your mouth, your hard palate, your soft palate, and say ah for me.
Ah.
Good, and your uvula moves back. And then your tonsils are present, but they're like 1+. I'm also going to look at the sclera and conjunctiva of your eyes. Good. Your sclera is white, and then your conjunctiva is pink and shiny, so that's good. Next thing we're going to move on to is your neck. So the first thing I'm going to do is I'm just going to palpate your carotid artery, one at a time. And that is about 2+. And I'm just going to look at your neck, and then I don't see any abnormalities, no lesions, no bleeding, no bruising. I'm going to palpate your parotid glands, your salivary glands. Can you look up for me? I don't know any swelling. And then your thyroid glands, I don't know any swelling either. And I'm going to just palpate your lymph. So we're going to start off with your prerectal, your posterectal, your submental, submandibular, jugulodigastric, superficial cervical, deep cervical chain, and your posterior cervical. Good. And then I'm going to test cranial nerve number 11. So I want you to just push your face against my hand. Good. Same thing on this side. Good. And shrug up against me. Good. And then also your supraclavicular lymph nodes. Go ahead and shrug up again. And I don't feel those either. And I'm going to test the range of motion of your neck as well. So look up towards the ceiling, down towards your chin, or down towards your chest. And then can you turn your neck side to side? Good. And then just shrug your shoulders, and then touch your ear to your shoulder. Good. And I'm going to have you go ahead and lay down. And I'm just going to look for any jugular vein distension. So at a 30-degree angle, I would have the bed, and I'll have you look that way. And I don't know any JVD, and I'll have you look towards me and towards this side. And again, I don't know any JVD. So that's good. You can go ahead and sit up again. So next I'm going to just take a listen to those carotid arteries, and I'm going to listen with the bell of my stethoscope. Good, and no noted abnormalities there. So then I'm going to move to your extremities, and I'm going to note your skin color is appropriate. I'm going to feel your temperature, and it's appropriate. And I'm going to look for clubbing and your capillary refill. So I don't know any clubbing, and your capillary refill looks appropriate. Same thing, temperature, clubbing, and your capillary refill is appropriate. I'm just going to feel your radial pulses. Okay. And I am going to have you squeeze my fingers as tight as you can. Good. Now I want you to pull me towards you. Good. And push me away. Good. Can you bend your arms like this? Pull me towards you and push me away. Pull me towards you, push me away. And I just want to see the range of motion, or actually first, let's hold your arms straight out for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then we're just going to test your range of motion. Can you bring your arms all the way up and behind your back in an upside down praying position? And then back around the other way in a praying position again. Good. So now I'm going to go ahead and I'm going to start with your respiratory system. So I note that you are not using any accessory muscles to breathe, and your respiratory effort is appropriate and rate is also appropriate. So I'm just going to take a listen with the diaphragm of my stethoscope. 5 positions in the front and 9 in the back. Okay, so in each location, just take a deep breath and let me know if you're feeling lightheaded or dizzy at any point, okay? So. Good. I'm going to have you just stand up so I can listen to your back. Okay. And then the 3 lobes on the right. The left, the 2 lobes. Good. Okay, you can go ahead and have a seat. So up in your upper airway, I hear bronchial lung sounds. Sorry. And then throughout your chest, I hear vascular lung sounds. And then throughout the lobes, I hear vascular lung sounds. So that's appropriate. So throughout your peripheral lobes, I hear vascular. So next we're going to go ahead and move on to your vascular system. So at first I'm going to listen with the bell of my stethoscope, and then I'm going to listen with the diaphragm, okay?
Mm-hmm.
Okay, so aortic. I'm sorry, let's start with carotid. So carotid again. Carotid. Aortic. Pulmonic. Tricuspid. And mitral. And I'm going to listen to the apical pulse for 1 full minute. And then with my diaphragm, carotid, carotid, aortic, pulmonic, tricuspid, mitral, and the apical pulse for a full minute. Okay. So next I'm going to have you go ahead and lay down, and we're going to do an assessment of your abdomen. So I'm just going to pull your shirt up, and the first thing I'm going to do is I'm just going to inspect. So I look at your abdomen. I don't know any lesions, no bruising, no abnormalities. And do you have any tenderness in any region? No. Okay. So I'm going to start off by listening in all four quadrants. Good. Good. And then 2 inches above the umbilicus is the aorta. And I'm going to listen with my bell. And then 2 inches to the sides are the renal arteries. And then 1 inch below the belly button is the femorals to the sides. Good. And then now we're just going to start, we're going to do palpation. I'm going to start with light palpation, and with light palpation I'm looking for any tenderness. And then we're going to move to deep palpation, where I'm going to be looking for any inflammation or swelling of the organs, okay?
Mm-hmm.
So with the pads of my fingers, I'm just going to do very light palpation. Good. Good. And then upon deep palpation. Good. Okay. And then also in my inspection, before I started my listening for bowel sounds and the palpation, I noted that your abdomen was symmetrical and the contour was appropriate. It was flat. So you can go ahead and slide your shirt down. Now what we're going to do is we're going to go to your lower extremities. So I'm going to note your temperature is appropriate. Your skin color is appropriate. There's no clubbing in your toes. And your capillary refill is less than 3 seconds. Again, no clubbing. Pedal pulses are present. And I'm going to test the strength in your extremities. So if you could raise this leg first for me and hold it for 5 seconds. 1, 2, 3, 4, 5. Good. This one. 1, 2, 3, 4, 5. Good. Pull towards you and push down. Good. Now I'm going to have you bend this knee up. We're just going to test the flexion of your hips. Go ahead, fan out. Good. Up. In towards you. Good. And straight. Same thing with this one. Up. Out. And then in. And then straight. Good. So the next thing we're going to do is I'm going to test the strength of your hips. So push out towards me. Good. Pull in towards you. Push out towards me. Pull in towards you. Good. So we can go ahead and move on to the strength of your knees. So I'll have you sit on the edge of the bed here. And go ahead and pull towards me. Yeah, sorry. Go ahead, pull.
Pull.
Good. Pull. And push. And push. Good. And can you plantar flex and dorsal flex? Good. The next thing we're going to do is we're going to move on to a neural assessment. So I'm going to touch you with a soft
Battery.
Oh, I'm going to touch you with a soft object, and I just want you to tell me when you feel it, okay?
Now, 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 now.
Perfect. And then now I'm just going to have you differentiate between sharp and dull. So this is going to be dull, and this will be sharp. Okay?
Mhm.
So just tell me when you feel it.
Dull, dull, sharp, 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 dull. One more time. Sharp, dull, 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 sharp, sharp, dull, sharp, dull, sharp, 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 dull, sharp, dull, dull.
Perfect. And next I'm just going to test your reflexes. So I'm going to use the diaphragm of my stethoscope. And then, just your feet hanging off the bed and off the ground. Okay, perfect. Good, there's a slight reflex. And there's a slight reflex. Okay, so the next thing we're going to do is we are going to test your bicep tendon. So I'm going to have you bend your elbow like this and do a quick flex for me so I can find it. Good. And go ahead and hang it and let it relax. Just like up like that. Relax. Oh, sorry. Okay. Good. And then on this side, the same thing. So can you flex for me? Flex. Okay, I found it. Right, go ahead, relax. Okay. So the next thing I'm going to have you do is we're going to do some cerebellar reflexes. So I'm going to have you touch the pad of your fingers to the pad of your thumb as quick as you can. Good. The next thing I'm going to have you do is I'm going to have you touch your nose and touch my finger, and my finger is going to move, okay?
Mm-hmm.
So go ahead, touch your nose and touch my finger. Touch your nose. Good. And then can you take the heel of your foot and run it down the shin of your other? Good. Perfect. So the next thing I'm going to have you do is we're going to have you stand up. We're going to do the Ramberg test, and I'm going to have you turn around. No, just as you were.
Okay.
And then close your eyes, and for 20 seconds we're just going to test your balance. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Good. And I'm going to have you walk to the table in your normal gait and walk back heel to toe. Good. And then one last thing I have to test on you is I need you to lay back again, I'm sorry, with your feet up. And I got to do a Van Minsky test, okay? So I'm going to run this across the heel, or across the middle of your foot at moderate pressure and across your toes, okay?
Okay.
Sorry, I didn't hear you. Okay. And then that concludes our assessment.